Welcome to today's exploration of neuritis, a condition that impacts the delicate network of nerves within our bodies. We'll delve into what causes this inflammation, how it affects the nervous system, and what can be done to manage and even prevent it. Neuritis at its core is nerve inflammation. This inflammation can arise from a variety of sources. Physical trauma, such as compression from a cast or repetitive motions, can irritate a nerve. Infections like herpes zoster, which causes shingles or Lyme disease, can directly attack nerve tissue. Autoimmune diseases such as lupus or rheumatoid arthritis may also contribute to nerve inflammation. Metabolic disorders like diabetes can lead to nerve damage, often manifesting as a type of neuritis. And finally, exposure to toxins like alcohol, lead, or certain medications can also be a contributing factor. The pathophysiology of neuritis involves a cascade of events triggered by the initial injury or insult to the nerve. Inflammation leads to swelling and increased pressure within the nerve itself, compressing the nerve fibers. This compression disrupts the normal transmission of nerve signals, leading to a range of symptoms. Prolonged inflammation can damage the myelin sheath, the protective covering around nerve fibers, further impairing nerve function. In severe cases, the nerve fibers themselves can degenerate, resulting in permanent nerve damage. Determining the precise epidemiology of neuritis is challenging, as it encompasses a range of conditions with varying underlying causes. Peripheral neuritis, related to diabetes or other systemic diseases, is relatively common. The incidence of neuritis secondary to viral infections, such as shingles, fluctuates with outbreaks. Neuritis caused by repetitive strain injuries is prevalent in certain occupational settings. Autoimmune-related neuritis is less common but represents a significant subset of cases. Factors like age, lifestyle, and pre-existing medical conditions can influence an individual's susceptibility to developing neuritis. The symptoms of neuritis are diverse and depend on the affected nerve or nerves. Common symptoms include pain, which can range from a mild ache to a sharp, burning sensation. Numbness and tingling are also frequent complaints, often described as a pins and needles feeling. Muscle weakness in the affected area is another hallmark sign, potentially leading to difficulty with movement or coordination. Changes in sensation, such as increased sensitivity to touch or temperature, or conversely, a reduced ability to perceive these stimuli, may also occur. In some cases, there can be loss of reflexes or autonomic symptoms like changes in sweating or blood pressure, depending on the nerves affected. Diagnosis of neuritis typically involves a thorough medical history and physical examination. The doctor will assess your symptoms, review your medical history, and conduct a neurological examination to evaluate nerve function. Nerve conduction studies and electromyography (EMG) may be used to assess the electrical activity of the nerves and muscles. Blood tests may be ordered to rule out underlying medical conditions, such as diabetes, autoimmune diseases, or infections. In some cases, imaging studies, such as MRI or CT scans, may be necessary to visualize the affected nerves and surrounding tissues. Neuritis can be classified based on the number and location of affected nerves. Mononeuritis refers to inflammation affecting a single nerve, such as carpal tunnel syndrome, which involves the median nerve in the wrist. Polyneuritis involves multiple nerves throughout the body, often associated with systemic conditions like diabetes or autoimmune diseases. Radiculitis specifically refers to inflammation of a nerve root as it exits the spinal cord. Understanding the specific type of neuritis helps guide treatment strategies. Treatment and management of neuritis focus on addressing the underlying cause, reducing inflammation, and alleviating symptoms. Pain management strategies include over-the-counter pain relievers, prescription pain medications, and nerve-stabilizing drugs like gabapentin or pregabalin. Physical therapy can help improve muscle strength and range of motion. In some cases, corticosteroids or other immunosuppressants may be used to reduce inflammation. Lifestyle modifications, such as weight management and smoking cessation, can also play a role in managing neuritis, particularly in cases related to diabetes or other systemic conditions. Surgical intervention may be necessary in cases where nerve compression is a major factor. Prevention of neuritis involves addressing modifiable risk factors. Managing underlying medical conditions, such as diabetes, is crucial. Avoiding repetitive motions and maintaining good posture can help prevent neuritis caused by nerve compression. Practicing safe work habits and using appropriate protective equipment can minimize the risk of occupational injuries. Limiting alcohol consumption and avoiding exposure to toxins can also help protect nerve health. Vaccination against viral infections like shingles can prevent neuritis associated with these infections. The prognosis for neuritis varies depending on the underlying cause and the severity of nerve damage. In many cases, with appropriate treatment, neuritis can be effectively managed, and individuals can experience significant improvement in their symptoms. However, in some cases, particularly when there is significant nerve damage, neuritis can lead to chronic pain and disability. Recent research has focused on developing more targeted therapies to reduce nerve inflammation and promote nerve regeneration. For example, advancements in immunomodulatory therapies are showing promise in treating autoimmune-related neuritis. Additionally, research into nerve growth factors and other regenerative strategies is ongoing, offering hope for improved outcomes in the future.